Which of the following is the definition of gestational hypertension? A. Blood pressure over 160/95 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. C. Blood pressure over 130/85 mm of mercury or rise of more than 35 mm of mercury systolic or 20 mm of mercury diastolic over baseline. D. Blood pressure over 140/90 mm of mercury or rise of more than 40 mm of mercury systolic or 25 mm of mercury diastolic over baseline. The answer is B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. Gestational hypertension is defined as a blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. It generally develops after week 20 of pregnancy and returns to normal after delivery. Which of the following is not a part of the triad of gestational hypertension? A. Proteinuria. B. High blood pressure. C. Edema. D. Headache. The answer is D. Headache. The classic triad of gestational hypertension is high blood pressure, proteinuria, and edema. New onset headaches during a pregnancy that includes gestational hypertension may be a sign of a more severe condition, such as preeclampsia. At what point in a pregnancy is preeclampsia most likely to develop? A. 0 to 12 weeks. B. 12 to 24 weeks. C. 20 to 32 weeks. D. After 32 weeks. The answer is D. After 32 weeks. Preeclampsia occurs more frequently in the last 8 weeks of pregnancy. Occurrence at an earlier gestational age is associated with increased severity and poorer outcomes for both mother and fetus. Which of the following increases risk of ectopic pregnancy? A. History of pelvic inflammatory disease. B. Endometriosis. C. Post-tubal ligation. D. All of these are correct. The answer is D. All of these are correct. Ectopic pregnancy is a serious condition in which an embryo implants in tissue outside the uterus. Risk factors include pelvic inflammatory disease, tubal ligation, endometriosis, tobacco smoking, history of infertility, and the use of assisted reproductive technology. Which of the following is a risk factor for development of toxoplasmosis in pregnancy? A. Undercooked meat. B. Contaminated water. C. Exposure to cat feces, often via a litter box. D. All of these. The answer is D. All of these. Toxoplasmosis is a parasitic infection that is capable of crossing the placenta. It can cause birth defects such as hearing loss, learning disorders, and visual impairment. Toxoplasmosis infection is primarily a concern only in individuals who have never been exposed to the parasite before pregnancy, as most people develop immunity to infection 6 to 9 months after their first exposure, often through contact with cat feces in litter boxes or soil. The main routes of toxoplasmosis infection in pregnant women are exposure to cat feces, water contamination, consumption of undercooked meats, and blood transfusion.